All right, today we're going to unpack the story of a real powerhouse antibiotic, clarithromycin. Now, if you've ever had one of those nasty chest infections or a really stubborn stomach ulcer, there's a good chance you've met this drug. But how exactly does it work? And, what are its hidden dangers? Let's get into it. So, this little box here holds a true workhorse of modern medicine. Seriously. Doctors rely on clarithromycin as a go-to weapon against a huge range of bacterial infections. It's really one of the most powerful and widespread antibiotics we have in our arsenal. But there's definitely more to this tablet than meets the eye. It's got a fascinating origin story, a really clever way of working, and yeah, a dark side you absolutely need to be aware of. So, we're going to break it all down.
So where did it even come from? Well, its story starts with an older, well-known antibiotic and a pretty clever bit of chemistry that was designed to make it just better.
Okay, so take a look here. On the right, you've got clarithromycin. It's just a slightly modified version of an older drug, erythromycin, over there on the left. See that little circled area? That's the key. Scientists made one tiny tweak. They added what's called a methyl group, which is really just 1 carbon and 3 hydrogen atoms. That one small change, it makes a massive difference.
And here's the payoff from that tiny little tweak. The new structure makes clarithromycin way more stable in stomach acid. And what does that mean for you? It means it gets absorbed more reliably, and, just as important, it causes fewer of those nasty side effects like nausea and stomach pain that were just so common with the older version. Okay, so it's a better version of an old drug, got it. But how does it actually defeat bacteria? Well, I want you to think of it less like a direct assault and more like targeted sabotage, shutting down the enemy from the inside out. So what is its secret weapon? How does it pull off this internal sabotage?
The answer is right here, inside the bacteria's own protein factory, the ribosome. Every living cell, bacteria included, needs these ribosomes to build the essential proteins that let it function, grow, and multiply. Without this factory running, well, the bacteria is pretty much dead in the water.
Let's break down the attack plan. First, the drug binds to a very specific part of the bacteria's protein factory, the 50S ribosomal subunit. This basically jams the entire assembly line. It blocks a crucial step called translocation, which you can just think of as the conveyor belt moving parts along. With that line jammed, protein production just grinds to a halt. Now, this doesn't usually kill the bacteria outright. It just stops them from growing. We call that bacteriostatic. This is huge because it gives your own immune system the time it needs to swoop in and clear out the invaders.
So, we know how it works. Now let's talk about which specific bacteria are on its hit list. And believe me, its range is pretty impressive. Clarithromycin is incredibly versatile. It's a key weapon against common respiratory infections like pneumonia, but it also tackles these atypical bacteria like Legionella. And even more critically, it's used for really serious infections like Mycobacterium avium complex, or MAC, which you see in immunocompromised patients. And of course, it plays a starring role in treating stomach ulcers. And this is probably its most famous mission, fighting Helicobacter pylori. That's the bacteria that causes most stomach ulcers. Clarithromycin is an absolute cornerstone of the standard 14-day triple therapy, where it's combined with another antibiotic and a proton pump inhibitor to completely wipe out the infection and let the stomach heal.
But hey, no powerful drug comes without risks. We've covered its origin and its secret weapon. Now we have to talk about its dark side, the side effects and the dangerous interactions that are so critical to understand.
First up, the common stuff. While it's definitely better tolerated than its predecessor, it can still cause some GI upset. But the one patients often remember is that distinct, really unpleasant metallic taste in their mouth. Headaches and rashes can also pop up.
Okay, now for a much more serious risk. Clarithromycin can actually mess with the heart's electrical cycle, specifically something called the QT interval, which you can see right here on this ECG. By making this interval longer, it can increase the risk of dangerous, even fatal heart rhythm problems. This is a huge deal, especially for patients who already have heart conditions.
And this is arguably the most important safety point of all. Clarithromycin is a potent inhibitor of a liver enzyme called CYP3A4. Think of this enzyme as the body's main recycling plant for dozens and dozens of other medications. Clarithromycin comes in and basically shuts down a key part of that plant.
And here are the dangerous consequences of that. With the processing plant slowed way down, levels of other drugs can build up to toxic levels. For example, if you take it with common cholesterol statins, it can cause severe muscle damage. With the blood thinner warfarin, it can lead to life-threatening bleeding. This is why you must always check a patient's full medication list before prescribing clarithromycin. And of course, there's another threat. The bacteria are fighting back. They are evolving ways to resist the drug's attack, either by changing the ribosome so the drug can't even bind anymore, or by creating these tiny little pumps that actively spit the antibiotic right back out. This is a growing problem all over the world, especially for treating H. pylori.
Okay, we've covered a lot of ground, so let's boil it all down to the absolute high-yield takeaways, the things you just cannot forget about clarithromycin.
First, its identity. It's a macrolide antibiotic, and it works by shutting down the bacterial protein factory at the 50S ribosomal subunit. Simple as that. Second, remember its biggest danger. It is a strong CYP3A4 inhibitor. This creates the potential for dozens of dangerous drug interactions, so you have to be vigilant.
And finally, its two most famous clinical pearls. Remember, it's a star player in H. pylori triple therapy, and it carries that serious risk of QT prolongation, which can mess with the heart's rhythm.
And that brings us to our final thought. Clarithromycin is a brilliant piece of chemical engineering, a drug that has saved countless lives. But as we see resistance on the rise, it really begs the question, how long can we rely on these workhorse antibiotics before the bacteria outsmart us for good?